Welcome back to Conversations with Boston School Psychologists, building safe and supportive schools one conversation at a time, where we spotlight the people, practices, and partnerships behind behavioral health in Boston Public Schools. I'm here with Cynthia Lay and Dr. Jennifer Green to talk about Project Provide, which is a multi-million-dollar grant awarded to the Boston Public Schools. Cynthia is the Project Provide grant manager here in Boston Public Schools, and Dr. Jennifer Green is a professor in special education and a child clinical psychologist at Boston University Wheelock College of Education and Human Development. The aim of Project Provide is to recruit and train school psychologists, school counselors, and social workers, and Boston Public Schools collaborates with UMass Boston, Boston University, and local community partners to support this effort. So let's get started. So starting with Jen, what led you to work with the Boston Public Schools Behavioral Health Services, and how has your respective work with the Behavioral Health Services Department evolved over the years? Go ahead, Jen.
Yeah, well, first, thank you for having me on this podcast. I've been watching your episodes and enjoying hearing your interviews with some of my colleagues and other people I know in school psychology. So thank you for having me on here. I got involved with behavioral health services in Boston about 10 or 15 years ago. I was working with a number of smaller school districts outside of Boston and helping them to develop multi-tier systems of support and to collect universal screening data from students. And I approached Andrea and asked her if she would meet with me, Andrea Hamador, because I had been hearing about all of the great work that she was doing in Boston. And I remember coming to her office and we talked for a very long time about the work that she was doing in Boston and some of the work I had been doing with other school districts. And she invited me to come and join the Boston School-Based Collaborative Meeting, which is a meeting that she hosts monthly for all of the direct service providers who come from outside organizations and agencies and provide mental health services in Boston Public Schools. So I don't know if she meant to just invite me to one or to invite me to keep coming for 15 years, but I kept coming and really learned a lot from the meetings and was looking for opportunities to contribute to the work that was happening in Boston Public Schools. So for a long time, I just sat in the meetings and listened and learned about the work that the behavioral health team was doing in Boston and the collaborations with other service providers in the Boston area. And then one day they were planning for their annual conference, which they continue to lead every year. And they said that they needed someone to run the evaluation for CEUs and that they were having trouble finding someone. And I thought, oh, that's something that I could do. So I volunteered and offered to do that and started collecting some data for them. And that was the first kind of time that I felt like I had an opportunity to bring something to them. And my partnership has continued to grow from there.
That's wonderful. Thank you so much, Jen, for your collaboration with the Boston Public Schools. And Cynthia, same question.
Yeah. Thanks so much for inviting me to this podcast, Jen. I really loved hearing about how your journey with BHS began. Mine's a bit more recent. So I had initially, before I joined this department, I was not familiar with the field of school psychology at all. And so I think that my journey with BHS has been a really amazing and beautiful one. I didn't anticipate, I think, doing all the things that I do now. It started off with me thinking I know that I'm very passionate about mental health and systems change work, and this is one avenue for me to continue doing this work, especially in a K-12 district. This environment is so much more than what I could have imagined to work for. It's a place where I really love to be, and I know that cares for other people. And the central question that we always orient ourselves is, how does this benefit to the well-being of children? And so seeing so much values alignment is really important to me, and something that makes me very grateful to be part of BHS. And yeah.
That's wonderful. Thank you, Cynthia. We're really happy to have you here. So, Jen, what is your involvement in the Project Provide grant, and how does it fund workforce development, readiness, and training to prepare current and future staff? If you can get into a little bit of the basics of Project Provide, and then Cynthia, I'll have you expand on Jen's answer. Go ahead, Jen.
Yeah, so to start, Project Provide is a grant that was funded as a mental health service demonstration grant through the U.S. Department of Education. Several years ago, the U.S. Department of Education put out a large call for these grants across the country, and BPS was one of the organizations that applied for the grant. I've been involved since the beginning in helping the behavioral health department to think about what the grant could be, and I supported them in the submission of the grant. The grant itself, it's called Project Provide. That stands for Partnerships for Readiness to Offer High Quality and Valuable Interventions in Diverse Educational Contexts. So we came up with the acronym Project Provide, and our goal is to train 40 interns a year in school psychology, school social work, and school counseling for a total of 200 interns across a 5-year period. We're currently in the middle of cohort 3 in the grant, so we've completed cohort 1 and cohort 2. And I think one of the most exciting things that has come out of the grant has been more intentional building of relationships between school psychology, school counseling, and school social work, which I know has occurred in the district, but also has occurred outside of the district with those of us who are in institutes of higher education and are the university partners. So as university partners, we come together with the behavioral health services team to think about how to build Project Provide opportunities and how to support our students who are the interns who are part of Project Provide.
That's wonderful. Cynthia, would you like to expand on that answer of Project Provide? Go ahead.
Yeah, so my involvement with Project Provide, so I'm the grant manager for the grant for the program, and I have the privilege of being able to work across all 3 departments, including so we have school counseling, social work, and the school psychology department, which is, of course, where the grant lives. But I'm also privileged with being able to work interdepartmentally at BPS with so many other wonderful folks who support the program as well. Those in budget, grants, and the ODA, which is the Office of Data and Accountability, who all support in making this happen. And so I think Jen explained how our grant works really well. We essentially have 2 streams. So there's the field supervisors and the interns, and our mentors and mentees who are current staff. And that's part of so our field supervisors and interns are our recruitment, and our retention piece is our mentors and mentees. So that relationship there, and then our training also contributes to some of our retention strategies. But it's been really amazing to see the kind of feedback that we've had over the years. I'll probably talk about it a little bit more later, but I sort of joined a little bit in the middle of the grant, maybe after the first year, and so it's been really amazing to see how it's grown over the years and how it really fits into the department. But I'm in a bit of a unique position where I work in BHS, but I collaborate pretty closely with other folks, and being able to connect with students and being a point person for them is also just very fulfilling. Is it can be so hectic and a little bit crazy being a grad student and also working full time or 3 days a week at a school district and doing so many things. So making sure that they know that I'm a point person for them, even though I might not have all the answers to payroll, or I can still help point them in the right direction and let them know that there's someone that they can count on while they're doing their internship here.
Okay.
Thank you, Cynthia. Yeah, go ahead.
I'm sorry, I didn't mean to cut you off. I just want to say that is support that is not always available in districts, and support that the grant is helping to fund. And typically, from a university perspective, the interns who are our students are placed in school districts like BPS for without any pay. And it's really challenging, as listeners probably know, to live in the Boston area or in other urban districts without pay. And so this grant has been really important to supporting our students in being able to get the training and to spend the time that they need to really focus on that training and to build their skills as mental health providers, and to have the support from Cynthia and the rest of the team to do that work well.
And students have told us too that because of the funding they receive from the grant, it's the reason that they don't need to pick up like a second job on top of their internship, and then also doing school. So it really like has a huge impact on students' like livelihood and like their educational experiences as well, and it really allows them to focus and learn while doing their internship.
Yeah, we know this is a really important year for them in their training. And so for them to be able to really engage in the district and take advantage of the opportunities available in the district and the learning opportunities at this really pivotal time in their training is an incredible opportunity for them.
That's wonderful. And Jen, a big component of the success that Boston Public Schools has been having is these amazing collaborations with community partners, including Boston University. And I was wondering, for a national audience of those in other school districts who want to hear the secret sauce, the success behind this collaboration between a school district and university partnerships, do you want to expand on that so other school districts can understand how to make a successful collaboration and partnership with community partners?
Yeah, it's been really exciting and meaningful to be a part of this work, and to be part of a very active collaboration that BPS has built between the school district and a number of us in local universities around the Boston area. And I think there are 4 or 5 universities that are a part of this collaboration. And we have done a lot of work to come together around a shared vision for what it means to do research, be engaged in research practice partnerships with a school district, and how to create a research plan and a research vision that is in the service of the school district and also benefits university researchers like myself and my students who are often involved in the research team, get training and working directly with the school district, and really thinking about how the research questions that we're asking and the data that we're looking at can be actionable and inform what's happening on the ground. Being able to do that is a really powerful experience as a researcher. I'll also say that the people who are involved are a big part of the success here. We have people who are really bright and excited and enthusiastic and committed to the work. And the behavioral health team at BPS has been the core of that. The core of the behavioral health team are people who value research and value these partnerships and have put a lot of time and energy into making sure that these partnerships are successful and are a valued part of their work also, and have really looked very deeply into how their work can be informed by research and by data. And for me personally, having tenure, so being in a position where I have some security in a university is a position of privilege to be in, to be able to say, okay, I don't have the same demands on me as I did as a junior faculty member or some of my colleagues do, and that means that I can engage in work that is sometimes more complex and that may take a little bit longer because we're engaging multiple partners. There can be challenges to the work and to the how long it takes to move forward with the work. And that is sort of what's ultimately needed to create sustained change and to create research that can have an impact in the real world. And that is just by design easier work to do from a secure position at a university than it is at other career stages.
Thank you, Jen. We're really grateful for these partnerships and for the people just like you who are bringing a lot of enthusiasm to this project. So, Cynthia, speaking of a national audience, school districts might also be interested in how to get started and where to get started. And I know that you were essential in getting this started. So, do you want to talk a little bit about that?
Yeah, totally. Um, so I came into this role for the grant about a year, maybe a few months after a year after our first cohort was onboarded, and so there wasn't someone in this position to facilitate some of like the programmatic pieces beforehand. Shout out to Andrea, who was able to like wear so many hats at the same time before I came into this position. But um, I think like there's a lot of there's like challenges, but also there's a lot of rewards in being able to see out a program like from the near beginning. There's a lot of like decisions to be made in terms of like, oh, well, what is going to be a set process? Is this something that we just kind of need to like trial out for this year? See if this process works in terms of onboarding all of the students. Right now, BHS has done like a really amazing job with dashboards and like arc of learning, and so Project Provide has adopted that and modified it to make a bit more sense for something that's used across all three roles, all three disciplines. And so making like tweaks as we go, and sort of understanding like what exactly we need to do to improve. And so much of that has been informed by feedback from the university students, especially the mentors, the mentees, and our field supervisors. There's a huge emphasis on data collection, and that we really value like their input, and it's so important for us to be able to share back exactly like how we've been able to use their feedback and the data we've collected as well. So we make sure to let them know like that their feedback is meaningful and it's actionable and it's valuable. So I think the other thing that to keep in mind as we develop a program. So we're in the third cohort now, as Jen mentioned, but there's a lot of, I think, forward thinking that we need to do, especially if there isn't necessarily a precedent set on how to do something. There's BPS has some really amazing teacher pipeline programs, but nothing, as far as I know, in terms of mental health service professionals in the district of pipeline or a program that's meant to intentionally train practitioners who are in schools. So we're in a bit of a unique position as where we're trying to learn as we go, but also be agile enough to make amendments where it's like really appropriate to do so. And I'm constantly thinking about what we're going to do next year, or like if I need to make like a tweak to I don't know, like our dashboards, for example. If I have like the same question a few times, I have this running document that's just like things to think about as we're planning for the next school year, and I'm constantly going back to it. So a few ways that I've been thinking about like like programming and implementation as we look forward.
Thank you, Cynthia. I noticed that each of you in your answers have really emphasized database decision making as a huge factor of the success that Boston Public Schools has had in Project Provide. And so I'm curious to know, what is the data saying? What are the trends emerging from these three cohorts? Starting with Jen. Go ahead.
Yeah, so at Boston University, we have the opportunity to help to coordinate the evaluation. So we of Project Provide. So we have been looking at these data as recently as this morning, actually. And we have data from cohorts 1 and cohort 2 at this point, because cohort 3 is still in process. And the main thing we've seen that's really exciting is when we look at the post data on people's experiences in Project Provide, there are really nice improvements from cohort 1 to cohort 2 in terms of what people got out of the program and how effective they felt like the program was in supporting their development and how supported they felt as a part of the program. And we are excited about that finding because we think that it really reflects the work that the behavioral health services team and the university provider partners have been doing to build the Project Provide program and opportunities for our students. So Cynthia was talking about building things as we go, and as we've been involved in this continuous process of quality improvement and improving processes and improving our organizations, we're really seeing the impact that has had on the success of the program from the intern's perspective.
That's wonderful. Great data and great feedback. Hearing how well this is going. Cynthia, do you want to expand on that, or did Jen pretty much cover it?
I think Jen spoke to it like really well.
Yeah, me too. That's fantastic news, though. Thank you, Jen. And just moving on to this next question, what keeps you hopeful in a time when school mental health is so needed and often under-resourced? What motivates you to keep pushing forward? Jen, we'll start with you.
Yeah, I love this question. I think there are a number of things that keep me hopeful. One is that there's a lot of attention right now to youth mental health in a way that there wasn't maybe a decade ago, and certainly not before COVID. And I think that there's been kind of public recognition that youth mental health is really important and should be an important priority. And we have seen that in different ways in the public discourse and in funding available. And I'm hopeful that even though mental health problems are not new, this kind of renewed focus on the importance of children's mental health will lead to new innovations and improved outcomes for youth. Another thing that makes me really hopeful is having a chance to go around and present some of our work at conferences and to people outside of the team here and hearing how much interest there is in the work that's going on in Boston and hearing how excited people are about the opportunities to build something similar to what is being built in Boston. But maybe the most important thing are the relationships that we've been able to build with each other on this team around our shared vision of the work that we want to be doing and how much we like each other and enjoy spending time together and doing this work together. I get to talk to Cynthia a lot, and I look forward to talking to her and the chances to see her in person in Boston and sometimes in other in other cities where we're traveling together and get to go around and really enjoy being together too. So so being able to kind of build these relationships together that we hope will help to inspire and promote changes and improvements to children's mental health.
Absolutely. The people are so important, and that shared vision is what keeps everyone going. I love that answer, Jen. And Cynthia, what would you like to expand on that as far as what keeps you going and keeps you motivated? Go ahead.
Yeah, definitely. I want to echo a lot of what Jen said, and this is why we get along so well. Like so much of the work that we do is very relational, and so being able to build relationships with people who have shared vision, shared values, shared mission is just super critical to staying motivated in the work that we do. So much of the grant we talk about like building relationships with like the supervisor and intern and mentor and mentee, and so also with the people who are sort of doing like the programmatic side, being able to present with folks. And I like what you said, Jen, this sort of like renewed focus on youth mental health. I am someone who has like benefited from, I went to a public school and also benefited from youth mental health resources like when I was a child. And so I think like that piece of like lived experience and also knowing how it can personally impact me is something that keeps me moving forward, even if there's like some barriers too. So I think regrounding myself and and sort of like refocusing, like there are all these people who are so passionate, and we keep ourselves like centered on the mission that we all share. So really want to like plus one what Jen said.
Yeah. Great answer, both of you. I love that answer. So let's end with something fun. We always end these podcasts with a fun fact. So can you share a fun fact about yourself? It could be travel related, a memorable person you've met, or anything our listeners might be surprised to learn. I will let either Cynthia or Jen, whoever wants to go first, go ahead.
I'll jump in. So I was formerly trained as a music educator, and so I play the viola. It's something that is very near and dear to my heart. And it feels kind of weird to say that like music is back to being a hobby now, when it was like for a really large time of my life, like my career. But playing the viola, I didn't think it'd be a fun fact, but I've been told that it's fun. So
I bet you're amazing at it. That's awesome, Cynthia. Jen, go ahead.
I'm going to build on the music theme. I'm part of a multi-generational singing group locally, and so I sing with my husband and my kids every week, and we've put on concerts. But unlike Cynthia, I am no good at it, and I am an early novice learner, and am loving that role. I really am enjoying being in a role where I am learning something new from the start, and am learning how to read music, and being part of a community of people who come together to join our voices and sing together of all different levels and skills.
That's awesome. I'll add to the music fun fact theme. My grandma was a piano teacher, so I grew up playing piano, but never really caught fire the way playing guitar was. And so I kind of self-taught myself how to play guitar. I was just obsessed with it in like middle school and high school, and, got into bands and stuff like that. And so it's always been a fun part of my life, playing guitar. So, all right. Any last words of wisdom, Jen?
This work is really important work. These grants are providing essential funding in schools for building the kinds of systems and supports that we want for all students. And I feel so grateful that the U.S. Department of Ed funded Project Provide, and am really eager for us to be thinking about how we as a country can continue to support these kinds of efforts to make sure that we're building workforces of high quality professionals who have the support that they need to be successful and to sustain the work that they're doing that is so important for children and families.
Absolutely. And thank you both for the invaluable work you're doing to contribute to that. Cynthia, any final words?
yeah, I just want to say like similarly, the increased capacity that we've been able to like scale up, like so many of these programs, we've had like some informal mentorship like before my time. And so it's so critical to be able to like strengthen these programs and like have something like formal and structured in place. And so with additional like capacity for us to do this kind of work, it only like compounds from there. And so it grows, and it pushes us in a positive direction for us to do important work for children and families.
Absolutely. I love that. Great answer. And thank you both for being on here. This has been so much fun talking with you about Project Provide. And thank you for listening to Conversations with Boston School Psychologists, building safe and supportive schools, one conversation at a time. Please follow us on our socials, Boston School Psychs, and visit our website, bostonschoolpsychs.com, to learn more about our work. Join our next conversation to learn more about resources and tips for creating safe and supportive schools. Thank you.